Okay, so in this video I'm going to explain the course of the radial nerve. Starting from the brachial plexus, the radial nerve is a continuation of the posterior cord, and the posterior cord is formed by all the posterior divisions of the three trunks, superior, middle, and inferior. So the root value of the radial nerve is the whole brachial plexus root, C5 till T1. Now some structures are faded or hidden in order to see the course of the radial nerve, which is presented here in pink color, as you can see. Okay, before we start, it's important to know this is the first part of the axillary artery. This is the second part here, behind the precalis minor muscle, and after it passes precalis minor muscle, this is the third part of the axillary artery. Now once it reaches the lower border of 3 major, it will switch from axillary artery, it will be called the brachial artery. Now here's the radial nerve. After the posterior cord, you can see it starts descending behind the third part of axillary artery and the proximal part of brachial artery. It lies over these muscles, subscapularis, 3 major, and the isthmus dorsi muscles. Then after this, it goes posterior laterally through an opening. So this is the posterior view. You can see these are the triceps heads. So this is the long head, lateral head, and medial head. So it goes through this opening here. It's called the triangular interval between the long and medial heads of triceps. It runs with the profunda brachial artery, which is a branch from the brachial artery. So the radial nerve and profunda brachial artery, after they pass through this opening, they run along a spiral groove here, or the radial groove called in the shaft of the shaft of the humerus, between the lateral and medial heads of triceps. So this is the triangular interval here. The radial nerve and profunda brachial artery passes from anterior to go posterior and run along the shaft of the humerus and the radial groove. This is the radial groove, which is highlighted in green here. Okay, so again, they pass along the radial groove. Once it reaches the lateral border of the humerus, the radial nerve pierces the lateral intermuscular septum to enter the anterior compartment. So this is the posterior compartment. Once it reaches the lateral border, it will go to the anterior compartment here. Okay, now it enters the forearm in front of the lateral epicondyle, between the brachialis medially and this is the brachialis muscle here, faded medial to it, and this is the brachyradialis, faded also, and this is the extensor carpiradialis longus muscle. So these two are lateral to the radial nerve, and this is the medial to the radial nerve. Now the radial nerve is one of the capital fossa content, and it's the most lateral part. It's now here at this area, the radial nerve will terminate and will give 2 branches: the deep branch of radial nerve and the superficial branch of radial nerve. Now the deep branch is a motor branch, and the superficial branch of radial nerve is a sensory branch. That makes sense because like the deep muscles are deep and skin is superficial. So let's take each one of them individually. Now the superficial branch of radial nerve descends on the lateral side of the front of the upper 2/3 of the forearm, under the cover of the brachyradialis muscle. Here it's faded. You can see it here. Okay, so and it lies over these structures. Okay, one by one. So here we have the spinator. This is the insertion of pronator teres, and here we have over the origin of radial head of flexor digitorum superficialis, and lastly we have the flexor pollicis longus. It runs along with an artery, radial artery, as shown here. So now after this, it curves along. It curves laterally around the radius, passing dorsally. Now here, within the hand, the superficial branch of the radial nerve passes over the anatomical snuff box here, and then it innervates the dorsal lateral surface of the lateral 3.5 digits and their associated dorsum area. So here 1, 2, 3.5 dorsum area of the hand. So this is the area supplied by the superficial branch of radial nerve. So again, this is so it goes in front of the anatomical snuff box, and this is the area supplied by the superficial branch of radial nerve in the purple as shown here. Now we go to the deep branch of radial nerve. Again, from the cubital fossa, it terminates here, the radial nerve terminates and gives deep branch, superficial branch. So the deep branch pierces the spinator muscle between the two planes of its fibers. Here, between the deep branch pierces the supinator muscle, and it between the two fibers to appear at the back of the forearm. So once it leaves the supinator, it will be called posterior interosseous nerve. So it will appear back at the back of the forearm. Now the posterior interosseous nerve, after it leaves the spinator muscle, it winds backward around the lateral side of the radius. Then the nerve runs in a facial plane between the superficial and deep muscles of the back of the forearm, along with an artery which has the same name, posterior interosseous artery here. At the end, it ends deep to the extensor retinaculum. Now here are the motor branches of radial nerve. So these are the muscles that's supplied by radial nerve. Muscles are supplied by the deep branch of radial nerve, and these are the muscles supplied by posterior interosseous nerve. So the main action here is extension, since it supplies the triceps and majority of extensors at the back of the forearm. Lastly, these are the skin areas that are supplied by the radial nerve and the sensory branches of radial nerve. Okay, so we mentioned the superficial branch, and here we have the three branches that arises from the radial nerve and from the upper arm, which supply these areas shown here. So that's it for the course of the radial nerve. Hope it helped.